A very good evening, all of you. Welcome to our day 3 dinner session. We'll go ahead with MCQs discussion from mineral trioxide aggregate, right? So we have around 10 questions, each question 4 marks. So maximum score for tonight, it's 40. So yesterday, we didn't discuss about scores, but tonight, we're not going to forget it. By the end of the session, you can post your scores in the comment section and let's see how many of you are going to reach to the maximum mark possible, right? So I hope you guys are ready. Just make a note of your scores. Consider that mandatory. Regarding points which we discuss, it's completely up to you, right? Because once the session is over, once this live is over, it's always available in recorded format and you can go through it anytime as per your convenience and time availability. So I hope your day has been fantastic so far. Let's make it even more amazing and wonderful with this live session. So do confirm the streaming quality, and if you have any issues with the streaming, including the audio output, do let me know in the comment section. I hope you guys are ready. Okay, thank you, Swadhina, for the feedback. A very good evening, everyone. I'll get back to your comments. So let's go ahead with our presentation. We'll start with first question. As you know the rules, we have a timer as well, 45 seconds timer for each question. Try to answer within the given time frame. So first question, I'm starting the timer now. Essential phases of mineral trioxide aggregate cement powder include, right? We're not talking about water. We're trying to eliminate water and we're trying to focus on the powder composition. So which of the following are the essential phases of MTA cement powder? Tricalcium silicate, dicalcium silicate, tricalcium aluminate, radio-opaque filler. You have 35 seconds more. So we have discussed about the composition of MTA in today's 5 AM session. Also, we had a short video with mosquito theme on the same. So I hope you have gone through that and enjoyed the video. So which one or which among the following do you think is or are essential phases of mineral trioxide aggregate? Tricalcium silicate, dicalcium silicate, tricalcium aluminate, radio-opaque fillers. So which one do you think is more appropriate answer? Also, along with this, we also have tetracalcium aluminoferrite. Also, we have calcium sulfate, calcium carbonate, right? These are also present. I didn't include them in the options. Among the given options, which are the essential phases? Okay, I see some of you started thinking smart and you started choosing multiple options, which is very commendable given the experience you had for the past few days. Very good. So it's a multiple right answer question. So among these, the essential phases include tricalcium silicate, all silicates, right? Silica based, right? Tricalcium silicate, dicalcium silicate, and radio-opaque fillers like barium or bismuth, because these impart radio opacity. Even this is considered to be essential phase. So A, B, and D. Tricalcium aluminate, tetracalcium aluminoferrite, these are present in minor constituents. Also calcium carbonate, calcium sulfate. So these are not considered essential phases. So tricalcium silicate is an essential phase. Dicalcium silicate is also an essential phase. And radio-opaque fillers. A, B, and D are right answers. So if any one of you have chosen A, B, and D, award yourself +4. Or if you have chosen only one of them, A or B or D, okay, you can award yourself 1 mark. And those who have answered A, B, C, D or all, please give yourself -1. Okay. Yeah, so essential phases of MTA cement. So the composition of cements is very important. In fact, also we had gone through compositions of other cements in recent discussion videos. Also, I mentioned about Grossman cement, which we faced during our AIMS exam. So the powder composition, we have various silicates, sulfates, carbonates, ferrites among these. Tricalcium silicate, dicalcium silicate, radio-opaque fillers are considered to be essential phases, right? Now, We'll discuss more about the setting reaction in the form of a different multiple choice question. Then we'll also go through these phases once again. So this is a composition of MTA type powders. Do make a note of it. And also you can see tricalcium silicate is present in major constituents. And also look at the weight percentages. That itself should give you the hint, which we discussed in today's 5 AM session. Almost all silicates, tricalcium silicate, dicalcium silicate are present in greater weight percentages. Also the radiopaque fillers, whereas the rest of them you can see 0 to 13, 0 to 18, 2 to 10. So these are considered to be minor constituents. The first 3 are essential phases, right? I hope it's clear. Okay, Ritu, you just saw, they're not my mosquitoes for your information. They are, they don't belong to anyone. They're just flying. Okay, I'm glad you saw the video. Now let's move on to the next question. I'm restarting the timer. Let's go. MTA sets by. Very, very important. Let's see how many of you are going to answer it right. Acid-base reaction, polymerization, hydration, none of the above. So which one do you think is more appropriate answer? Mineral trioxide aggregate. So we have seen acid-base reactions. We know about polymerization reactions. So how does MTA set? In fact, we had a brief discussion regarding this in our morning 5 AM session as well. I hope every one of you will answer it right. And those who answer it wrong, I'll give you an imposition. 10 times. Okay, MTA sets by which are the following reactions. So there's no acid-base components here. We're just trying to add water. Even the newer editions of MTA, we have polymers and all, but the conventional MTA, right, which we have been discussing from Phillips, MTA sets by hydration of silicates. So consider this term very, very important. So it's simple hydration reaction. Okay, so as you all rightly mentioned, option C is right answer. So also you can see the powder and liquid dispensed, and also you can see a putty-like consistency which is obtained. We'll discuss more of this in the coming MCQs, right? So it is hydration reaction, hydration of silicates. In fact, the hydration starts at the periphery and then progresses towards the inner aspect gradually, okay? Now let's move on to the next question. I'm restarting the timer. Here you go. A main disadvantage associated with the use of MTA. It has limited indications. It is more cytotoxic than GIC. It is bioinactive. It has longer setting time. So which one do you think is more appropriate? In fact, in our discussion in 5 AM session today, we have seen some indications of mineral trioxide aggregate. We've seen that it can be used for repairing perforations, root and cavity restorations after epicoectomies. Also in several studies, also in our post-radiation clinical practice, we use it as an obturating material after epexification, epexogenesis, where we need to stimulate the natural dental tissue formation. In fact, in morning session, I mentioned that when it is used as root end material, cementum-like substances were formed. They reported cementum-like substance formation, right? Also, it can be used as obturating material, as I mentioned, and pulp capping, vital pulp therapies. So we have a good set of indications for MTA. In fact, I've shown you the illustration if you remember. It is more cytotoxic than GIC is a completely false statement. As per literature, it is less cytotoxic than GIC. It is considered to be more biocompatible material. And option C, it is bioinactive. Again, it's completely wrong. MTA is one of the bioactive materials. As I said, as I discussed early morning, bioactive materials are those that stimulate natural dental tissues into repair, right? They stimulate dental tissues formation. It can be cementum, it can be hydroxyapatite. So that's the greatest miracle that can ever happen. Once hydroxyapatite is forming, we have numerous benefits, as mentioned in Phillips. It helps to improve the bonding. It helps to seal the interface between the restoration and tooth. Also, in case of implants, right, the bone integrity with implant surface greatly is enhanced. So bioactive materials are like a boon to our profession without any doubt. Also, we have a question on bioactive materials. We'll get back to that again. So it is bioactive. So you can rule out ABC. And as majority of you, I think almost every one of you have chosen, it has longer setting time. So the initial set, as we discussed, can anyone tell me the same? Because I already repeated this in the morning session. So I want one of you to give me the initial setting time and final setting time, approximate values, right? So option D is the right answer. Wonderful. So that's considered to be one of the major drawbacks of MTA, right? It has longer setting time. Now let's move on to the next question. Fourth question, let me restart the timer. Indications for MTA include all except. I'm sure you can answer this. By mistake, I just discussed all these. Some of these or all these, I don't know the indications. Yeah, indications for MTA include pulp capping, root end filling, obturation, root canal sealing. So which one do you think is the exception? Exactly. Very good, guys. So the initial setting time is around 160, 165 minutes. So more than 2 hours, 2.5 hours. And the final set is around 6 hours or less than 6 hours. So indications for MTA include all except. So which one is the exception? So as we have just seen, it can be used for pulp capping, stimulates dentin-like formation, dentin material-like formation, dental tissue formation, root end filling. It stimulates cementum layer-like formation, obturation as well in case of apexogenesis, apexification procedures where MTA is used as obturating material, most commonly nowadays, previously calcium hydroxide. Yeah. In fact, in one of the literature reviews, they mentioned that if we use calcium hydroxide, we need to change the dressing every 3 months. But if we use MTA in place of calcium hydroxide in that given clinical context, because it is literally insoluble once it sets, right? You need not keep changing the material. MTA, that's another advantage we have associated with MTA. So obturating material, root canal sealing, yes, all of the given option. I'm sure you guys becoming more and more smart with each section. Okay, very good. So it's none of the above. Well done. So all of the following are indications of MTA. You can see some illustration representing various indications: percussion, perforation repairs, root resorption repairs, apexification, apogectomy, lateral perforation repairs, pulpotomy, pulp regeneration, vital pulp therapies, pulp capping, etc. Okay, very good. So it's none of the above. Please, those who answered none, award yourself +4. Now let's move on to the next question. Powder liquid ratio of MTA. So these are purely memory based. So you need to remember. You can make a note. And once you have that in your memory, you're never ever going to forget. Take my word. Is it 5:1, 1:1, 3:1, or 10:1? Yeah. So what's the powder liquid ratio of MTA? It's good that you're trying to answer this question. You answered this question, some of you, in less than 10 seconds, which is commendable. So those questions which you can answer fast, you should definitely do it, because not every question takes 45 seconds. So powder liquid ratio, it varies. It actually varies from 4:1, more of powder. 4:1 to, yeah, 2:1. But majority of powders, as mentioned in Philips, they use 3:1. Yeah, 3:1 ratio, as you all rightly mentioned. Option C is right answer. Anyways, once you are into clinical practice, you need not worry about remembering this. In entrance, of course, you need to remember, but in clinical practice, all the instructions are given along with the powder, along with the material. But having said that, it's always good to have an idea. Very good. Option C is right answer. And also you can see the powder and liquid. So once you mix powder and liquid, so the pH rises very rapidly. The pH rises to around 12. And the matrix which is formed is very rigid, containing calcium silicate hydrated materials along with calcium hydroxide. So this calcium hydroxide is the basis for various advantages we have associated with MTA. Like because of formation of calcium hydroxide as an end product, this material is antibacterial and antifungal, as I discussed in the morning session. And also calcium hydroxide, the pH rises, right? So all the advantages associated with calcium hydroxide we can see in MTA as well. Yeah. And once the hydration usually starts at the beginning and it proceeds towards the center, right? Very good. Option C is right answer. Now let's move on to the next question. If mixed MTA is not used immediately, so just prior to this, we have seen like mixing, and then using gloved fingers, we can convert that or roll that into a putty-like consistency, cut that into pieces with a spatula, and then use it depending upon the indication. However, if the mixed MTA is not used immediately for various other reasons, what should you do with that mix? It should be discarded as it gets dried. A moist gauze tent can be placed over the material to prevent dehydration. Place it in a small bowl of water, any of the above. So which one do you think is more appropriate if the mixed MTA is not used immediately? 10 more seconds for you to answer this question. Good. It seems you're going through literature as well. So that's one of the greatest advantages you have when you go through standard literature. You're never going to answer it wrong. And moreover, since you actively involve in referring, you're never going to forget it. Fantastic. Option B, as almost every one of you are choosing, is right answer. You take a moist gauze, make it into a tent and place it over the material to prevent hydration. What about option A? It should be discarded as it gets dried. May be true if the waiting period is more than 1 hour or 2 hours, because up to 1 hour or 2 hours, the material is still in initial set. So there is no question of drying. But if it is beyond that, maybe we should discard it. So among the given options, option B is the right answer. Do award yourself +4. Now let's move to the next question. 7th one, assertion and reason. Assertion. Thorough flushing of root canal irrigant should be performed before placing an MTA mixture. Let's assume we're talking this in endodontic context, in root canal treatment context, apexogenesis context or apexification context. Whatever it is, endodontic context, thorough flushing of root canal irrigant should be performed before placing an MTA mixture. Reason, common canal irrigants often contain EDTA as one of their components that partially dissolve and impair the seal of MTA by chelation of EDTA to calcium in MTA. So what's your opinion? Assertion and reason are true. Reason justifies assertion. There is no justification. Or reason altogether is false. Or do you think assertion is false? So which one is more appropriate answer? We really wish we had such questions during Viva, right? Where the examiner gives us all questions in the form of assertion and reason. And for sure, the answer is always option A. If that's the case, it's very convenient for student to answer questions. No pressure, no tension whatsoever. Okay, so thorough flushing is important because, as you all rightly mentioned, there can be chelation. If there is any remnant irrigant, EDTA-based irrigant, it can chelate to the calcium in MTA, right? Compromising the setting, right? So option A is right answer. So it's important that flushing of root canal irrigants should be performed before placing an MTA mixture for this very reason, okay? Common root canal irrigants contain EDTA that dissolve and impair the seal of MTA by chelation of EDTA to calcium in MTA. Do make a note of it, or just keep this in mind. Consider this very, very important. All clinical based or clinical oriented questions. Now let's move on to the next question. Option A is right answer. Yeah. 8th question. During pulp capping, resin-based composite or an interim GIC can be placed directly over MTA. However, HN should not be applied on MTA. Why? Acid destroys the acid etchant. Acid destroys the integrity of MTA. The etchant prevents setting of MTA. Both? None. Which one do you think is more appropriate answer? Let's take the context here is pulp capping. So you go ahead with pulp capping using MTA, and then you need to place a restoration over this. So when you're going for a resin-based composite, let's suppose, you have to place etchant in the cavity before you go with restoration. In such a case, should we place etchant on MTA and then continue with the restoration? If not, why? So basically that's the question. Etchant should not be applied. So directly we're telling you that etchant should not be applied, but why? As it destroys the integrity of MTA. It's water-based, as it destroys the integrity, and also it prevents the setting of MTA. Because of these two reasons, etchant should not be applied on MTA. Always keep that in mind, because once you enter into post-graduation or into clinical practice, just keep this in mind, because the objective will be compromised if you go ahead with a placement of etchant over MTA. Right? So option C, as some of you have chosen, is a right answer. Okay, please award yourself +4 and rest of you -1 very sincerely. Okay, good. Well tried. See, if you're wrong, you have nothing to worry about, because as I said, we learn greatly and things will be registered even in a better way when we make a mistake. However, we should be oriented towards learning, right? So, as you can see, pulp capping, various pulp capping materials, calcium hydroxide, MTA, modified MTA. Yeah. So I've just given you an illustration to provide you a context. Option C is right answer. Very good. Now let's move on to the next question. Which among the following, the penultimate question, which among the following are bioactive cements? So in morning session, if you remember, I said there are so many bioactive endodontic cements, we call them as B, C. So I said I would give you the list. So among the following options, which one do you think is bioactive cements? There is a huge list, of which I had to pick various exceptions in order to make this MCQ. So which among the following are bioactive cements? MTA, biodentin, calcium enriched mixture cement, endosem. MTA for sure is bioactive, because we have been discussing about MTA. We also discussed why it is considered to be bioactive. So MTA obviously is the answer. So would you go with MTA? You want me to log MTA? In fact, I've given you a hint. I said I've gone through the list. I wanted to give you the list. So I think that gave you a hint. Okay, well tried, well tried. So all of the above. So if you had chosen all, award yourself +4. And you can also go through the literature review. In fact, I have taken a screenshot of a PubMed indexed article. It's an abstract where they presented the list of various bioactive endodontic cements. You can just go through it now. So MTA, biodentin, calcium enriched mixture cement, endosem. Yeah, as you can see, MTA is bioactive endodontic cement, mainly comprised of calcium and silicate elements. Introduced by Turabin Ejad, Loma Linda University, 1990s, and approved by FDA, United States, 1997. And interestingly, Portland cement, the basis of this MTA, was first used, and a case-based study was published way back in 1870s, according to Phillips. But Portland cement was no longer used. I will discuss that later. So a number of new bioactive endodontic cements have also been introduced. Why is Ritu smiling? Because I gave you a hint. Okay. So the list includes bioaggregate, biodentin, bioroot, calcium enriched mixture cement, endo, CPM, endosem, endosequence, endobinder, endoseal, iRoot, micromega, MTA by MTA, Filapex, MTA plus. We used MTA plus in our post-graduation, Neo MTA plus, or the MTA, QuickSet, Retro MTA, Tech Biosealer, Therocal, LC, LightCure. Please don't get worried. You need not mug up all these names, but at least go through them so that you are familiar with the names. That's it. That's the only objective of providing you with that screenshot. Okay? Good. All of the above is right answer. Now let's move on to the next question. Final question of this session. Why MTA? Why mineral trioxide aggregate? Why not Portland cement for human use? Because, as I said, Torabinejad has come up with MTA, which is based on Portland cement or construction cement. So why should we use MTA? MTA is very costly for your information, whereas a cement bag is comparatively cheap, even though the prices are increasing. But comparatively, buy a cement bag, you'll get a lot of cement, mix it with water, and then use it. Why not? So why MTA? Why not Portland cement for human use? What's your opinion? Option A, it's unethical. Option B, Portland cement should be used only in constructions. Option C, there are no radiopaque fillers in Portland cement. Option D, of course, we can use Portland cement for humans because it is economically commensurate or it's economically viable option. What do you think? Pretty seriously you want to use Portland cement for humans, then you should stack up cement bags in your clinic very soon. But remember, I'm going to complain to IDA and DCI and they're going to take care of you. I'm just kidding. Okay, so which one do you think is more appropriate? Tejal seems to be smart. She says Portland cement should be used only in construction. If that's the case, Tejal, you know, toothpaste is not just used for brushing teeth. It has numerous other applications also, even in facial cosmetology and all. In that case, why are we using toothpaste for other applications? In that case, why did Torabinejad come up with MTA, which is based on Portland cement? Yeah. So I'm really glad that majority of you have chosen option C, which is right. So Portland cement, no one is going to take a radiograph to evaluate the depth of penetration of cement in a construction area. So it appears radiolucent if used. There are no radiopaque fillers in Portland cement. So MTA, the mix has been standardized with along with the addition of radiopaque fillers, which is very, very important. However, that's not only the right answer for this question. Option C is right, but along with that, it's also unethical because any material which we are supposed to use in human subjects, males or females, it has to be standardized, it has to be regularized, it has to be approved, and it should be able to perform consistent results via clinical trials. Why do you think we have FDA? Why do you think we have these ISO or organizations which take care of standardization? So it is unethical as well. So option C, yes, go for it, +4. If you have chosen option A also, it's acceptable, okay? Of course, Portland cement should be used only in constructions. There is no debate in that. And we should not use it in humans for the obvious reasons which we discussed. Okay, very good. We have your Portland cement there. Okay, I hope you enjoyed today's session. I thoroughly enjoyed today's session along with you, interacting with you. Now present your scores. We're forgetting this. Out of 40, what's the top score? Let's see. And what's the least score? Let's see. And where majority of you are? Let's see. Hi Sujay, a very good evening. Hi Swadina, a very good evening. Fernandez, hi. Hi Sona. Hi Saurabh, Dr. Nidhi, Tejal. Yes, Tejal, definitely. We'll definitely include image-based questions. In fact, if you go through the archive, in various playlists in our YouTube channel, you can find image-based MCQs as well. But anyways, we'll do them again. We'll do additional images through live. Definitely, we'll consider your request. Hi Samiksha, a very good evening. Felicia, hi. Hi Vinita, a very good evening. Hadi, Ritu, Pallavi, a very good evening. Hi Vaishnavi. By the way, Ritu, it's not my mosquito, it's our mosquito video, okay? Exactly. In fact, I wanted to share my experience as well. Sadina, I'm glad you shared it. Yeah, it's like almost grainy or sandy appearance. That's true. See, if in case you can't use it immediately, you can add water. And again, there will be reconstitution. Again, there will be rehydration. But it has to be within 1 hour, within the initial set period. Okay. Yeah. Hi, Arnab. Are you Arnab Goswami? If you're Arnab Goswami, please tell me. I'm not your biggest fan. Hi, Arnab. You need not apologize. A very good evening. Okay. 30, 33, 25, 15, 25, 25, 26, 20, 22, 40. Ritu, come on. I think your kids helped you in answering the questions. Gunjan, very good. Very good, guys. So if you're not comfortable sharing your scores, that's absolutely fine. I can understand. At least you can get back through mail, right? So you have any queries, you need any assistance, always feel free to get back through mail 24/7. And we have a match going on. So what's the update? We'll check it out as well. And tomorrow, we'll have a discussion on shared guide. Okay, while we do shared matching, we have Vita Classic, Vita 3D, so sequence. So we'll have discussion on that tomorrow morning, and then we'll have related MCQs discussion in tomorrow's dinner session. Okay, right? Shared guide, shared matching. How do you do it? That's the initiating question. Okay. Arnab says, but I'm a big fan of your work. Thank you, Arnab. Appreciate all your love and affection. It means a lot. Hi, Dvaipayan. Hi. A very good evening. Okay, guys. So I know the match is going on, but still, you joining live, it's definitely a big deal. Yeah, Vita Plus, Vita 3D. In fact, we had questions on the same in previous entrances. We'll look into it. And yeah, Vita shared guides. And as I said, the thumb rule here is no one should say thank you. If you feel like you should say thank you, instead say, we will give our best. WWGOB, a shorter form for your convenience, okay? Never say thank you in our sessions. It's a rule. If you say thank you, you will be banished. Just like how Sheldon banishes some of his friends. Big Bang, I'm a big fan of Big Bang. Hi, Ramya, very good evening. Okay, guys. So let's keep this enthusiasm and momentum going. And please try to sleep early as soon as possible and try to join our 5 a.m. sessions also. Initially, it will be a huge challenge starting your day early, but once you get used to it, you'll see the other side of positivity without any doubt. I'm sure most of you are experiencing, those who are joining us in 5 a.m. sessions. You have all the wonderful, positive time for yourself, for all your activities, and you can make maximum use of your day, right? I know it's a challenge, but it's a challenge which you can overcome. Right. So wish you all the best. Love you all. I'll be seeing you tomorrow morning in 5 a.m. session. Dream big. Ta-ta.